And next up, we have Paul Sonnier, who is the head of the digital healthcare group on LinkedIn called Digital Health, appropriately, and is also an industry principal at Frost & Sullivan. And Paul will be joining us today from Southern California, and will be moderating a panel with two impressive leaders in digital health and who are doing great work in helping improve women's health from both Salesforce and Vicert. Paul, welcome to the program. Thank you for doing this important panel.
Well, thank you, Stan. It's a pleasure to be here, especially in my new role now with Frost & Sullivan. So delighted to be joined by Voja and Geeta. So let me change my screen here for a second. So I'd like to give you a quick background on Frost & Sullivan and my new role. So Frost & Sullivan, many of you may have heard of the company. It is a research and consulting firm that helps clients accelerate growth. It's been around for about 60 years, and it focuses on applying actionable insights to create a stream of innovative growth opportunities for companies, governments, and investors. So we're a team of experts based in 45 global offices, generating intelligence spanning 10 industries, 35 sectors, and 300 markets. So quite an impressive team I've joined. And I'm working on the healthcare and life sciences growth opportunity analytics side. And so we engage with medical device, diagnostics, digital health, and life sciences companies to capitalize new growth opportunities in collaboration with growth coaches, analytics, and advisory teams. So I know that's a lot, but I'm excited to be on the team and be helping clients. So great to be here, Stan. Thank you again. And it's an honor to be talking with Geeta and Voja. And we're going to be speaking about CRM meets healthcare. And so for those of you, just to refamiliarize everyone, a CRM, and this is from the Salesforce website, is customer relationship management. And it's a technology for managing all of your company's relationships and interactions with customers and potential customers. And the goal is simple: improve business relationships to grow your business. A CRM system helps companies stay connected to customers, streamline processes, and improve profitability. And so we're going to be talking about how that translates into healthcare. So let's start off with an introduction, round of introductions. So Geeta, could you go first and give us a background on yourself and your company, please? Salesforce. I think you're on mute, Geeta.
All right. It doesn't matter how many years we've been doing this, that still keeps happening.
Exactly.
Sorry about that. So thank you again for having me. I'm Geeta Nayyar, I go by Dr. G here at Salesforce, and I'm the Chief Medical Officer for the company. And really, you nailed it, right? What we are trying to do in the market is truly power the business of healthcare in what we call the 360 on the platform. From a 360 view, you and I both understand that there are multiple stakeholders in the healthcare ecosystem. And really, it's about aligning everyone to the right incentives, aligning everyone with the right technologies, and making sure, again, that we keep the patient at the center. And we think CRM has been doing this in other industries for quite some time, and it's time to do it in healthcare. And my role really spans the gamut of bringing that clinical relevance to both our products and solutions, to our strategy, as well as how we go to the market and talk and have these conversations with customers and partners.
Wonderful. Thank you. And Voja, give us a background on yourself and Vicert, please, if you will.
Sure. Thanks, Paul. Hi, Geeta. Hi, everybody. So I founded Vicert 20 years ago as a digital health and health IT focused services company. We have, over these 20 years, worked on over 300 projects in US, from payers to providers to the product companies, software product companies focusing on digital health and health IT. Generally, we would work with early stage companies and disruptors and innovators that are entering the space, with established companies and newly minted unicorns, and then with some of the largest payers and the hospital systems in US. Generally, we can provide significant impact and help to leaders in IT, or the leaders in general in the organization, who can articulate the business need and what the goal is, and what they expect the health IT and tech to help them accomplish, but for one reason or another are not able to flush out the requirements, the regulatory, the legal, the technology needs. So given the domain expertise that we have built in the space over the years, and the core tech capabilities, we can move that forward. And I think that's our uniqueness, that we bring all that to the table, yet we have a relatively small team that can engage very effectively and quickly and move the needle in 3 to 6 months, and allow a product to be rolled out to the market and to the users. So that's it.
Yeah, that's wonderful. Thank you. And Voja, maybe you could elaborate a little further on a recent example I think you did with USC, and was it DARPA? I'm trying to remember. It was really fascinating what you're working on in women's health and mental health.
Sure. I mean, that's one example of over the years we've engaged in the mental health and the women's health area quite a bit. So the project that we have done with the hospital system down in LA was focused on trying to understand the impact of stress with the nurses and nurse practitioners as they work through their daily, like a day in of life of a nurse, and basically we were able to put together significant, like this whole, from the cloud standpoint, it's really a mega trend. From a sensor availability standpoint, is another mega trend. So what we are able to do is put the software together that basically interfaced or integrated more than a dozen sensors, some on the person, some at home, some in the building, to track and understand on a very data specific level what is going on. Also, the nurses were able to put subjective information about how they feel and what they've been doing and so forth. So all of that was collected in a backend system that had analytical capabilities in the cloud to give us some insights. And it was a double-blind study. Several hundred nurses were involved in this site, and there was a separate site that was doing the same survey. And this started pre-pandemic, actually. So hopefully there was some good information that was that the organization and others were able to leverage, as obviously we know nurses have had taken a brunt of the load and work in the hospitals during the pandemic. So it's amazing how it really, the ability to leverage a cloud or a solution like a Salesforce, that is a platform really on which you can build a solution like this and provide very sort of practical use and leverage the analytics in the back end is amazing. And it's amazing that relatively small companies were able to actually move a needle this way. 10 years ago, you would need to dig a hole in the ground and put your own data center up and all that stuff. And the cloud definitely changes that and democratizes the ability to innovate, which is really what we need here. So
that's really wonderful, Voja. I think you highlight the need for platforms, digital platforms like Salesforce's Health Cloud, which is a vital tool. And so when we're talking about CRM meets healthcare, Salesforce is, of course, the #1 company in CRM. So Geeta, could you kind of take over here and just segue on to what your platform, the value of your platform, the digital transformation that Salesforce has maybe undergone, if that's relevant. And we'd just love to hear your perspectives.
Sure, happy to. Well, boy, it's tough to follow there. I think both of us are clearly like-minded, and our curls were getting curlier as he was speaking. I could sense it. So, look, we all.
Getting thinner here, but it's okay. Yeah.
We had this whole conversation about hair. Remember, Paul?
I know.
when we all had better hair, right? So look, I think we all appreciate how broken the industry has been, and certainly COVID made that even more abundantly obvious than we all knew. And so if you think about the value proposition of Salesforce and the power of our platform, it's really that secure, connected platform that is able to provide agile solutions from anywhere to empower the provider, the payer, and really driving towards everything, right? Financial results, clinical results, administrative results, those all have to align for a business, for a hospital system, for a payer to be successful. And the power of our platform is the ability, the agility, the scale, and to future-proof your business, right? Things change. I mean, we go into hospital systems, they've got 25-point solutions, 25 to do this, 35 to do this, right? It's a disconnected experience. And as healthcare has grown, continues to be consumer-centric, continues to be do-it-yourself, you need a platform to help you grow your strategy, but not to disconnect the experience for the patient. The patient doesn't care on the back end what's happening. Yeah. But you as the provider, you do, right? You need to achieve all of those different results. You need to connect financial with administrative with clinical. And the power of the platform and the security of our platform is undeniable. Right. And again, I said it before, we are not trying to certainly disrupt the legacy systems. The EHRs continue to be needed, but we want to complement those legacy systems. We recognize that those are clinical team focusing technologies. They're not administrative focused, they're not financially focused, and they're not patient focused. So we really work well in bringing that wrapper around those legacy systems to do exactly what we said, which is we call it the customer 360, and we call it powering the business of health, right? It might be a little bit provocative, but it is a business. And the only way you can power it is if you connect and align all of those different incentives internally and make sure the patient doesn't feel it. At the end of the day, it's about making sure the patient doesn't feel it, and it has to be from anywhere. We know we live in a mobile world, and we know people are at home or on the move. So we got to meet the customer where they're at, like we've done in every other industry.
Yeah, I think that's fantastic. I think what you mentioned really highlights, as Voja did, really empowering the patients, empowering the providers, and kind of removing that back end being in your face the whole time and becoming a challenge to do your job or to be healthier, manage your condition or what have you, be diagnosed or treated. So maybe, Voja, maybe you could take that over and tell us a little bit more about your thoughts on how you've worked with clients to do that. I think we may be running out of time here shortly. Stan and Jerry can keep us on track.
Yeah, I mean, maybe one example to build on what Geeta said. I had many conversations with the leaders at the Children's Hospital down in Orange County, where an orthopedic department was looking to open up to basically, for example, allow a family to choose meals for the child that's at the hospital expecting surgery. So it's like the EHR system will not have that functionality. And it was actually, the ask was coming from the medical team, not from the parents. But so you can see that there is this need internally and recognition and understanding that EHR can get us so far, but we need these capabilities built on top of that will allow a broader support team for a patient or a child patient, even more so, to participate and to support the patient while at the hospital. So we understand, and it's really the ability to open up the interface and to remove the friction, that's like for those outside of hospitals and those in the hospitals. And there is a huge opportunity to leverage the cloud and have information have capabilities in the cloud that can network better and kind of get out of in the building, in the data silo of a specific hospital or a specific insurance company or so forth. So those, I mean, even the mandates are the government mandates are actually coming out that are now pushing that and forcing that over the next couple of years, because we digitized the health record, but we kept it in our own box under the desk. So we need to make that next step and overcome the resistance that
Yeah.
we encounter every now and then. So
Yeah, I like that. Resistance removal, making things frictionless. So, I mean, it sounds like that's what you're doing. And Salesforce, of course, Geeta, maybe you can close us out with some final thoughts on removing friction in the system writ large, or just any other final thoughts you may have. I don't want to direct you on that.
Thank you for that, Paul. Look, we're living in a time where there is real physician burnout, care team burnout, and as a result, staff shortages. And patients, customers are coming to the hospital, coming to the doctor's office because they have a problem and they're looking for a service. They don't care about the back end, right? But you and I both know, we all understand that the back end, when it creates friction on the front end, that leads to a poor experience for the patient as well as a poor outcome. And a team member, a care member of the team that's just not able to do a good job because they're too busy clicking and hunting and trying to document, trying to bill, et cetera. And so as we think about the future, we really need to focus on the fact that digital transformation is here to stay. It needs to be invested in. Our healthcare infrastructure cannot take another hit. And new technologies like a CRM are really important along with our legacy systems, right? It's taking that new innovative mindset of just the systems that we had 20, 30 years ago are not the healthcare of today. And the consumer's expectations have dramatically changed. And again, the back end is important as it relates to the front end, because at the end of the day, that's your customer, is that patient. And so being mindful of greasing the skids on the back end is directly related to physician burnout, directly related to the patient experience, and directly related to the bottom line. And that's what we're doing here at Salesforce. Again, we really believe in powering the business of health, and that the only way to do that is with a 360 point of view on the front and back end.
Wonderful. Well, thank you, Geeta. Dr. G, as you said, you go by. Boy, I really appreciate your thoughts as well. So digital health is fantastic, Stan. What more can we say?
It's making progress, no doubt about it. And it is definitely changing the way people are doing things in healthcare. The infrastructure, as Dr. G and Voja have talked about here, and Paul, as we read every day on your LinkedIn posts, is truly changing now. And I think we're at the beginning of what over the next 10 years will be a complete and total transition from old healthcare to new healthcare. But thank you all for this tremendous panel. Really appreciate it. Thank you, Paul.
Thank you.